Have been tracking COVID numbers since the beginning of the pandemic, and as we continue to look at the numbers, we're noticing something interesting. Flu numbers are down to 0. It begs us to ask the question, did COVID restrictions wipe out this flu season? Our Christie Diez takes us behind the headline.
It all started when we saw this tweet from a clinician at Emory that says, anecdotal report that cases of flu went down to nothing this year, supposedly due to social distancing and face masks. Dr. Carlos Del Rio responded with this article, which says before coronavirus, we were on track to have one of the most severe flu seasons in decades. But thanks to stay-at-home orders, social distancing, and masks, the flu season was cut weeks short.
Can you tell me, one, how you came upon the article and how true you think it really is?
Oh, I think it's totally true.
So I started crunching the numbers in Georgia. I logged all of the flu reports since the beginning of the year, right before the pandemic really kicked in. And it showed the flu was widespread until about April. Then things started to change.
I looked at the numbers and it's an incredibly steep drop.
No, it's incredible. I know. Down to nothing, right?
Yes, literally 0. Check out this graph. By the beginning of April, flu outbreaks were down to 0. By the time we hit May, flu hospitalizations and deaths were too.
Based upon these numbers, do you think it's fair to say coronavirus measures have nearly wiped out this flu season?
I think there's no doubt about that. I think that they were very effective medicine to slow coronavirus and to wipe out the flu.
An unintended consequence with a positive outcome, but still not exactly a reason to celebrate.
Whatever was saved was rapidly overtaken by the coronavirus. I mean, I think the number of deaths we've seen from coronavirus far outweighed even the worst of all seasons.
He's right. The numbers show here in Georgia more than 2,600 deaths are linked to COVID-19, while 94 are because of flu. But Dr. Del Rio says knowing this could help us turn around flu seasons in the future.
So another important note here is the flu and coronavirus have different seasons. Doctors are still trying to figure out the season for coronavirus. So they did spike at different times, but based on the numbers, these measures cut our flu season short by about 6 weeks.